Good morning everyone, it's Dr. Abdullah Haber, you know me. In the first video that we shared before together, we spoke about the scientific part of Zahntium dental implant. In this video, we're gonna dive more in the practical and surgical part. And we're gonna see how easy to manipulate the surgical cut during the surgical procedures. That is the surgical cut, okay? We follow step by step the protocol of preparation from one to the desired implant dimension. The stoppers are all graduated. We choose the convenient length according to the dimension of the implant. We also have two implant holder, long and short, two parallel pin of different dimension to check the angulation of the implant before insertion. We also have an extension drill, drive adapters, and 5 different dimension of drills for countersinking in bone type 1 and 2. As we see here, this is the panoramic view. We're gonna put two Zahntium dental implants, one on each side, and this side is a new extraction side from 4 months ago, and this is an old one. As we see here again, we have a big amount of bone, so no need to dental scan, but for more information we can go for it if we need it. The patient is ready in the operation room, and now she's waiting for us. Yeah, let's go. We begin with the first pilot drill, 1.5 millimeter. The second pilot drill is 2 millimeters. The depth is 11.5 millimeter. The same length of the implant that we choose. To make sure that we reach the depth 12.5 millimeters, we put the stopper convenient to the surgical cut, and of course we use the extension drill if it's necessary, as we see here. Now we use the drill number 3, 2.8 millimeter. At the same depth, using also the stoppers. Also the extension drill is in use again. Step number 4, drill 3 millimeters. Also the same depth as before. Just to remind you, a pumping movement during the drilling to prevent heating the bone, not to destroy the cells around the implant, surely with big amount of saline water. And finally, the drill number 6 to target our implant diameter. To ensure that we are in the same direction of our preparation, we can use the parallel pin again as in the first steps of our preparation, because as we see here, it's a narrow space between the two teeth, since we have an old extraction and surely the molar is in a Mazio version. Also, during my preparation, I felt that the bone is little bit hard, especially in cortical part. That's why I will go for a countersinking, not to make pressure on the cell and prevent a resorption in the future. And make sure that the countersinking is done in lower speed, between 15 and 100 RPM, to control a good precision. Personally, I insert the implant manually for a better control. Now the ratchet. Cover screw. When we use the surgical kit correctly as indicated, the implant must be in good position, meaning 0.5 to 1 millimeter under the cortical bone.